Chemotherapy. For many, the word itself carries a profound weight, conjuring images of a difficult and uncertain journey. It can feel overwhelming, a complex medical term shrouded in fear and apprehension, but knowledge is a powerful tool for navigating this path. So, let's take a moment to demystify chemotherapy, to understand it not as a vague threat, but as a calculated, powerful, and constantly evolving science. Let me break it down for you, clearly, calmly, and with the depth it deserves. At its core, chemotherapy is exactly what its name implies. Chemical therapy. It's a category of medicine that uses powerful chemical substances to treat disease. While the concept is now synonymous with cancer, its origins are rooted in the early 20th century. Scientists, studying the effects of mustard gas during World War I, observed its profound impact on rapidly dividing cells, particularly in bone marrow. This tragic discovery sparked a revolutionary idea. Could a similar controlled chemical agent be used to target the uncontrollably dividing cells of cancer? This question launched decades of research, leading to the first successful cancer treatments in the 1940s and laying the foundation for modern oncology. To understand chemo's unique role, it's helpful to compare it to other primary cancer treatments. Surgery and radiation are considered local therapies. They are incredibly effective at removing or destroying cancer cells in a specific, defined area. A single tumor in a lung, for example. Chemotherapy, however, is a systemic treatment. Once it enters the bloodstream, it travels throughout the entire body. This gives it the crucial ability to hunt down and attack cancer cells that may have metastasized or spread from the original tumor to distant organs, as well as any microscopic cells left behind after surgery. So, how does it work? The fundamental principle of chemotherapy lies in exploiting a key vulnerability of cancer: its relentless, rapid growth. Cancer cells are defined by their uncontrolled proliferation. They ignore the body's natural signals to stop dividing, growing and multiplying much faster than most of our healthy, normal cells. Chemotherapy drugs are designed as cytotoxic agents, meaning toxic to cells, that specifically target cells in the process of division. Because cancer cells are dividing more frequently, they are statistically more likely to be caught in the act by the chemotherapy, making them the primary target. There isn't just one way to stop a cell from dividing. Different classes of chemotherapy drugs attack this process at different stages. For example, alkylating agents work by directly damaging a cell's DNA, creating unbreakable bonds that prevent the DNA helix from unzipping to be copied. If the cell can't replicate its genetic blueprint, it cannot divide. Another class, antimetabolites, act as imposters. They masquerade as the essential building blocks of DNA and RNA. When a cancer cell mistakenly incorporates these fake components into its genetic material, it disrupts the entire synthesis process, leading to fatal errors. Other drugs, like anthracyclines or mitotic inhibitors, interfere with the physical machinery of cell division, preventing the formation of the spindle fibers that are essential for pulling one cell apart into two. The ultimate goal of all these strategies is the same: to damage the cancer cell so severely that it can no longer replicate, triggering a process called apoptosis, or programmed cell death. Because cancer cells are notoriously adaptable and can develop resistance to a single drug, oncologists often prescribe a combination of chemotherapy drugs. This approach, known as combination chemotherapy, is like a multi-front assault. By using drugs that attack different phases of the cell cycle or use different mechanisms of action, it becomes much harder for the cancer to survive. This strategy increases the overall effectiveness and can reduce the likelihood of resistance. This powerful systemic attack on fast-growing cells is chemo's greatest strength, but it also explains its most well-known challenge: side effects. While cancer cells are the primary target, they are not the only rapidly dividing cells in the body. Several types of healthy tissues also rely on constant, quick renewal. This includes the cells in our hair follicles, which are always growing. It includes the epithelial cells that line our entire digestive tract, from the mouth to the intestines, which replace themselves every few days. And critically, it includes the hematopoietic stem cells in our bone marrow, the factory responsible for producing all of our red blood cells, white blood cells, and platelets. Because chemotherapy cannot perfectly distinguish between a rapidly dividing cancer cell and a rapidly dividing healthy cell, it inevitably causes collateral damage to these tissues. This is why common side effects occur. Damage to hair follicles can lead to hair thinning or loss. When the lining of the mouth and gut is affected, it can cause mouth sores, nausea, vomiting, diarrhea, or constipation. The impact on bone marrow is particularly significant. A drop in red blood cells can cause profound fatigue and weakness. A low platelet count can lead to easy bruising or bleeding. And a decrease in white blood cells, especially neutrophils, compromises the immune system, leaving a patient vulnerable to infections. It is crucial to understand, however, that not everyone experiences every side effect. The type, dose, and duration of the chemotherapy, as well as an individual's overall health, play a huge role. Importantly, most of these side effects are temporary, as healthy tissues are resilient and begin to repair themselves once the treatment is complete. Furthermore, managing these side effects is a central part of modern cancer care. Your medical team has an extensive toolkit to help prevent and treat them. Prophylactic anti-nausea medications are now so effective they can prevent sickness before it even starts. Medications called growth factors can be given to stimulate the bone marrow to produce white blood cells more quickly, reducing the risk of infection. Pain relievers, mouth rinses, and dietary adjustments can soothe mouth sores and digestive issues. Your team will work proactively with you, creating a personalized plan to maximize your comfort and safety throughout the treatment process. How you receive chemotherapy depends on the specific drugs being used. The most common method is intravenous or IV infusion, typically administered in a hospital outpatient clinic or a dedicated infusion center. This can last anywhere from a few minutes to several hours. Other chemotherapies are available as oral pills or capsules that you can take in the comfort of your own home, which requires careful adherence to the prescribed schedule. Less commonly, chemo can be given as an injection into a muscle or under the skin. Treatment is almost always given in cycles, a period of treatment followed by a period of rest. This rest period is vital. It gives your healthy cells, like those in your bone marrow and digestive tract, a chance to recover and regenerate before the next dose, helping to manage side effects and maintain your strength. For decades, chemotherapy was the primary pillar of medical oncology, but today, the landscape of cancer treatment is vastly more sophisticated. Modern cancer care is not just about chemo. We are in the era of precision medicine, which includes two other revolutionary classes of systemic therapy: targeted therapy and immunotherapy. Targeted therapies are drugs designed to lock onto specific molecular targets or mutations that are present on cancer cells, but not on most healthy cells. They interfere with specific pathways that fuel the cancer's growth, often with fewer side effects than traditional chemo. Immunotherapy doesn't attack the cancer directly at all. Instead, it unleashes the power of your own immune system, removing the brakes that cancer cells use to hide and enabling your body's T cells to recognize and destroy the invaders. These therapies are not mutually exclusive. In fact, their greatest power often lies in combination. Sometimes they are used alongside chemotherapy, sometimes they are used instead of it. The decision is deeply personal and scientific. Your oncologist will create a plan tailored specifically to you, based on a wealth of information: the exact type and stage of your cancer, its genetic and molecular profile, your overall health, and, just as importantly, your personal goals and values. So, will it cure the cancer? In some cases, yes. For certain cancers like testicular cancer and some leukemias and lymphomas, chemotherapy can be curative on its own. In many other scenarios, its role is strategic. It can be used as neoadjuvant therapy to shrink a tumor before surgery, making it easier to remove. It can be used as adjuvant therapy to eliminate any microscopic cells that may remain after surgery or radiation, reducing the risk of recurrence. And for advanced or metastatic cancer, chemotherapy can be a powerful tool to control the disease, slow its progression, alleviate symptoms, and significantly extend and improve a person's quality of life. Throughout this entire process, it is essential to remember that you are not doing this alone. You are surrounded by a dedicated multidisciplinary team. Your oncologist leads the strategy, but they work in concert with specialized oncology nurses who administer treatment and manage side effects, pharmacists who prepare the drugs and check for interactions, dietitians who help you maintain nutrition and strength, and social workers or therapists who provide crucial emotional and logistical support. This team is your resource. Communicate with them. Ask questions. Report your symptoms. Advocate for your needs. They are there to guide, support, and empower you every step of the way. Chemotherapy is a journey, and while it demands courage and resilience, it is a path paved by science, guided by expertise, and walked with hope.